Hi everyone, my name is Mustafa. I'm a PGY2 resident at Yale, presenting today with my co-residents Sean, Sergio, and Sarah. We'll give you an overview of our residency program and what life is like at Yale in New Haven. Our program coordinator is online here as well. Please feel free to ask any questions. We'll answer all of your questions. Next slide, please. Here you see our leadership from left to right, Dr. Latanza. She is the Department Chair of Orthopedics and Rehabilitation. Next one is Dr. Eslam. She is our Physical Medicine and Rehabilitation Division Chief. Then you can see Dr. Hankinson. She is our Program Director, and Dr. Tokars is our APD. And also Dr. Letelier is the other APD and our VA Site Director in West Haven. Next slide, please. Okay, so here's the list of our faculty, starting with Dr. Rosen. He is our consult attending in the main campus. Dr. Odonkor, Dr. Henke, Dr. Raju, Dr. Dantes, Dr. Sanuwan, Dr. Holder. They are mainly focused on interventional physiatry. Dr. Belisario is our sports medicine attending here, and Dr. Morgado Vega is our inpatient rehab attending, and she is the IRU director. Next slide, please. We also have supporting core faculty, Dr. Framberg with orthopedics and Dr. Doherty with neurosurgery. We have 3 months of ortho in PGY1 in the main campus and 1 month of neurosurgery in PGY2 in Lower St. Memorial Hospital. And we work with those great physicians. And next slide, please. All right, here we are, PGY2 on top. Me, Sean, Sergio, and Sarah. We are all here online as well. And our interns, Christina, Tyler, Danny, and Avish, they are surviving with the medicine team this year. Next slide, please. The next resident will be taking over from here.
Hey everyone, so I'm Sean, I'm taking over. I hope you can hear me. I'm going to assume you can. So Program Basics is a 4-year categorical program. So you do an intern year with us, which is great. 4 residents per year and 4 weeks of vacation each year, which is really nice. During your intern year is 2 2-week blocks. And as a PGY2, you have more freedom in how you want to break it up. Right now we're doing 1-week blocks. Um,
Sorry, give me 1 second.
Otherwise, for like education stuff, we do have monthly grand rounds as well as journal club. As a PGY2, you'll be the ones leading journal clubs. That's what we're doing currently. And grand round is done in conjunction with the orthopedics department. We also do conferences, lecture series with EMG, lifestyle medicine, and M&Ms. And then also we also have wellness and togetherness. So just like some fun stuff we do as a department or just among ourselves. So whether we do like the annual clam bake in connection with the ortho department or just hanging out doing dinner amongst residents or even doing department dinners with just like the rehab department, which is really nice. And then office hours is I don't know if it's really regular, but whenever you want to talk to anyone, you can just text them, and then the faculty is super responsive and easy to chat with. So it's been really nice, and you get mentors every year. You can meet up with and talk to about what your goals and aspirations are, and they've been super helpful, actually. Next slide. Life in New Haven. So New Haven, I describe it as a glorified suburb. It is technically a city, but coming from New York City, it doesn't quite feel like one. But on the plus side, you have the perks of what a city has. So yeah, anything you can think of, New Haven has at least 1 or 2 options to do it, whether it's like going out to get food, bars, events, so on and so forth. And it's super walkable. We all live within walking distance, which is super nice. And it's honestly a very easy city to live in. Technically, you don't need a car, though I do recommend getting a car, especially for PGY2 year where you're going to North Memorial for some rotations. But it's very easy and livable city. Next slide. And then more things to do around New Haven, but not quite in the New Haven area. You have New York City just 80 miles away, so it's about an hour and a half to 2 hours driving depending on traffic. Or Metro North takes you straight there, which is super easy. Boston, also super close, also have a train ride. And then home to Tweed Airport, which is a small airport about 15-ish minutes away. Super cheap flights. Not the most destinations, but if you're going up and down the East Coast, you are set. So that's pretty nice. Next slide. And then for our rotation sites, so here you have listed Yale New Haven Hospital or York Street. That's the main campus that Mustafa referenced earlier. You have Lawrence Memorial Hospital. This is in New London, so about a 50-minute drive away, going north. That's where you'll do some rotations for your inpatient service as a PGY2, as well as doing the neurosurgery rotation as well. And the VA is in West Haven. It's about a 10-15-minute drive from us in New Haven. You'll be there primarily for some outpatient PGY2 as well as some rotations as a PGY1. The bottom is just a couple more pictures of different places. So the bottom left is the Healing Garden at York Street. The Yale shuttle, which goes between the main campus and a smaller hospital. We also work at near called St. Raphael's campus, and then the atrium at York. All right, next slide. And I believe Serge is going to take over now and talk about each of the individual places we rotate.
Yeah, hey guys. My name is Sergio. I'll go ahead and take over and just talk about all of our different sites, and I think I'm also going to be talking about our schedule. So Milford, which wasn't mentioned as one of our sites, it's one of our main inpatient rehab units that's about like a 15-minute drive from the main campus. And basically we see a lot of different complex type of patients here at Milford. As you can see, we have patients with amputations, a lot of joint replacements, TBIs, SCIs, hip fractures, multiple traumas, neurological disorders, OA, rheumatoid arthritis, severe burns, and stroke. The unique part about this inpatient rehab unit compared to our other one is that we have a hospitalist who works in the inpatient unit, so we work as a consult service. So basically, we focus on the rehab while the hospitalists work on the medicine side. And I think the slides went down, but yeah, just one second. But yeah, so in Milford area, we have 24 beds. Since we're a brand new program and we're the first PM&R class that's working there, it's a kind of unique experience that we have because we tend to oversee all of the patients while also having help from the attending, and it gives us kind of like a unique experience in the way that, like, since we don't have to worry too much about the medicine at this specific site, we can just kind of go and focus on the rehab on all the patients that are on the unit, which is very interesting. Next up, we have Lawrence and Memorial, which is our other inpatient rehab unit, and that one has 16 beds. Here, we're both the hospitalist and the rehab, so you work as like the main doctor, and you get a lot of complex patients here as well. We work with TBI, stroke, neurological conditions, spinal cord injuries, spinal surgery, debilitations, and lower extremity amputations. And while we're on Lawrence and Memorial, every Wednesday for half a day, we work with Dr. Tokarts to work at his amputation clinic. Next slide, please. Some of the unique educational experiences that we have here at Yale. We are getting exposure to rehabilitation engineering, which is pretty cool. We've been working with the Yale School of Engineering and also an engineering school in Austria, in which they bring engineer students over from Austria, and they work on interesting new devices that we can use in the inpatient unit. I know that myself and actually everyone here has actually worked on different research projects, and we have some ongoing projects that we're working on, which is pretty cool. We also provide lifestyle medicine education. So throughout our residency, we'll have the opportunity to work with our faculty who already are lifestyle medicine certified within hopes so that we can eventually get the lifestyle medicine certification once we graduate. We also offer a research track, which any resident that's interested can go into this clinical research track, and most of your electives will be focused on research. And just to add a little tidbit about research here at Yale, most of our faculty are involved in research, and it's overwhelming how much support we have from all of our faculty. Everyone's really excited to work with us. So if you want research, it is everywhere to be found, which is really cool. Next slide, please. We also have experience with wound medicine and surgery. Sorry, I don't know if you guys can hear the sirens outside my window. But anyways, yeah, we have experience with wound medicine and surgery. I know that Dr. Aslam, who's the chief of our program, she kind of spearheads this, and we'll have robust clinical and research, which allows us to work with patients who have very complex wounds. And we also offer a chronic wound care and regenerative medicine fellowship program. For any of us who graduate from the program, we'll have the opportunity to do this 1 year non-ACGME fellowship training program. Next slide, please. And this is just a sample from our from our schedule for PGY1 and PGY2. So last year, as Mustafa mentioned, we are we're a 4-year program. So you do your first year here. That entails with 10 months of internal medicine. 3 months of orthopedics. The rest is internal medicine, but within that internal medicine, you get a month of rheumatology, a month of elective, and a month of inpatient rehab. So it gives you like a little preview into what we're doing for the following 3 years. In PGY2, which we're currently in, we have general rehabilitation, we have a wound rotation, a neurosurgery rotation, consult service, prosthetics and orthotics, EMG, and electives. And just to mention, for the first year, our rotations are 2 weeks long. We switch every 2 weeks. And then from PGY2 through PGY4, our rotations are 1 month long, except for when you're at L&M right now, we are there for 3 months at a time. And then going into PGY3 and PGY4, we'll finish up our inpatient rehab, and we'll also have MSK and pain clinic, sports medicine, some exposure to pediatric rehab, continue with EMG consults and general rehab and electives. And most of the stuff that we do in PGY3, we also do in PGY4. I think the way that the schedule is set up for our 3rd and 4th year is that it allows us to have a lot of freedom to kind of focus on like what we want to do. I know that out of the 4 of us, 75% of us want to go into interventional medicine. So during these 2 years, it gives us a lot of opportunity to work with our interventionist attendings, which we have a good amount of. So pretty cool experience. Next slide.
Next, I'll be talking about the call schedules. So, and my name is Sarah, by the way. So in terms of the intern year, internal medicine and general orthopedics both have calls. We don't have a 24-hour call system for internal medicine, so you'll either be on day service or night service. And for orthopedics, it will likely be some form of night rotation during your floor services. So usually patients who have gotten surgery recently. For residency for PGY2 to 4, calls will be limited to home calls. So this year, the 4 of us are doing calls 1/4 of the year each. Didactics will be an 18-month curriculum, and this is some of the topics that we will discuss throughout the months. Last month was MSK, and this month is stroke rehab, and generally it's been half resident-based and half faculty-based. And then finally, the big thing that I wanted to mention here was that we do have a medical student away rotation elective. It is by VSLO only. It is a 4-week rotation and is restricted to 4th-year medical students. The students should be familiar with PM&R as a specialty, and 2 weeks of the 4 weeks will be in inpatient rehab, which is divided into Lawrence and Memorial Hospital, which Sean had mentioned, along with Milford, which Sergio has mentioned a little bit more in depth. And then the other remaining 2 weeks will be mostly outpatient, either consults, wound, sports, or interventional physiatry. The big thing for this elective is that students will be assigned to various sites, so you will need your own transportation. But at the end of the rotation, you should have a good foundation for PM&R, and you'll also be required to present a journal article of your choosing related to any field, or present a case report, which one of the residents can help you with as well. So just to summarize, if you are excited to be part of a residency in an established department, have passion for patient care, or want to be part of new research and innovative medicine, we'd love to hear from you. We prioritize an environment rich in diversity, and we're very committed to inclusion and equity. So if you think this is the right choice, please reach out. So this is our website. We also just made a residency PM&R Instagram account like a few days ago. So feel free to follow us. And our program coordinator is listed below, Ronahi, and you can send her any emails. And that's it.
Thank you so much for your presentation. So, any questions from the participants?
Hi. Um, I was wondering if you had any opportunities with adaptive sports, and if you all are involved in that at all currently. I know that you guys are very new, and getting more opportunities, I'm sure, but I was just wondering. Thank you.
I guess I can start with this. So currently we don't have anything for adaptive sports. We are definitely interested in doing more with it. And I know some of the orthopedics team is interested. So if you are interested in, adaptive sports, Nicole, we can certainly give you the contact info of like our friends in ortho, and we can do like an interdisciplinary research project. That's definitely possible.
That sounds great. Thank you.
Yeah, quickly, Nicole, I'd like to add, I know that we're a new program, but I guess the unique thing about our specific program is that we're coming into an established department. And since we're underneath ortho, we actually share a lot of resources and a lot of ideas with our residency. So I know that some of the ortho residents have been working with adaptive sports. So if anyone was interested in our program, they could just reach out to them and it would be very easy to have that accessible to anyone who's interested.
And I see a question here from Morgan asking about our roles and responsibilities in the OR. That's a great question because I remember coming into residency being concerned, as I'm not the biggest ortho, like OR person. But generally, what I've learned is that the attendings there, both in ortho and what I've heard for neurosurgery, is that they're really just trying to prioritize like a learning experience for you, trying to get you a better sense of the anatomy, what types of surgeries they offer, so that when you are in outpatient clinics or if you are interested in interventional physiatry, you have that knowledge. So I haven't found it to be intimidating or overwhelming at all.
Just add on to that, all the attendings as well are very understanding that we're not going to be doing surgery in the future. So they let you get as involved and not involved as you want to be. If you want to open, if you want to, debride, if you want to do anything you want to do, they're more than happy to show you how to do it and walk you through step by step. If you just want to kind of stand by and like assist and then talk through it and like learn the anatomy, they're also happy to do that. So it's very open to what you want to do, and it's really good like time to learn what you want to be attending or fellow.
And just to quickly to add to that, I was also very nervous going into it because we have so much surgical experiences in our residency, but honestly, it was a really, really helpful experience, both in neurosurgery and ortho. I feel like it really gave me like a better understanding of the patients that are coming from those specific type of populations. Like after seeing a couple of joint replacements and like seeing traumatic surgeries in ortho, I understand what exactly the patients have gone through, and it gave me like a better understanding once they're in rehab. And same thing with neurosurgery. I feel like during those two rotations, I got like a really good understanding of how to read imaging that is related to those two fields. So overall, it was a really positive experience.
And William, we got your question about rehab. Rehab engineering exposure. So I loved the rehab engineering portion that we did last year and this year. All four of us are involved in some form of rehab engineering. Essentially, Dr. Morgado Vega in Milford kind of facilitates a lot of the projects, and we work with Austrian undergrad and graduate students who sometimes come from their campus to ours in order to, show a research project that they've done. So this year, it's been a lot of like hand spasticity and using, engineering to help facilitate some of that hand motions, or instead of a modified Ashworth scale to quantify the like angles for spasticity. So those have been really interesting and cool.
Thank you, Yale, for your wonderful presentation. It's lovely to see so many residents from the class.